Welcome to the third week of class. Your discussion posts were very good, and I saw how many of you provided wonderful feedback to one another. As you'll read in Chapter 4, if you haven't read it already, it'll share how students learn not only from the work that they do, but also from their peers. Now, these discussion posts that you've been participating in and your responses are a great example of this learning. So this week we're going to continue to discuss active learning strategies and how they fit within higher education. You'll have a reading assignment, a discussion question, and then your first paper assignment. So let's look at chapters 4 and 5. Chapter 4, the focus is on an environmental science degree, but you'll see how very similar it is to nursing when they start talking about the importance of critical thinking skills and interdisciplinary collaboration, which is also required within our profession. The authors are going to discuss an activity with 3 assessments and the benefits of these activities. So they'll talk about a practice essay, a communication exercise, and a practice presentation. And these are actually done over a period of time, not just within one semester or one course. Then in Chapter 5, you're going to discuss the benefits of teaching within the environment, which again is going to be very similar to nursing clinicals. So there are 3 case studies which will discuss experiential learning. And one of those case studies is actually a short-term study abroad case. And I'm not sure if you had an opportunity to do any study abroad experiences with students, but it is an amazing experience for everyone. I've actually had the opportunity to travel to South Africa with students twice, and it was actually nursing and aviation students. So it was a collaborative effort. Both groups kind of went off and did their own thing during the day, but then they got back together in the evening and shared their various experiences. So we both learned from one another. The nursing group, we worked in a small rural hospital and learned about nursing in that country, or specifically that area of South Africa. And nurses have responsibilities there very similar to nurse practitioners. So one of the main things that we did is we worked with nurses in their HIV clinic and observed how they function and saw that they handled all the issues that occurred during the day, and a physician only came in once a week to then handle those patients who may have been outside of the scope of practice for the nurses, or they felt that they couldn't necessarily handle them properly. Now, nurses, or sisters as they're called in South Africa, function also as nurse midwives. So the students who were there had an opportunity to see several live births, which they really, they're very lucky to even see one live birth here in the States. So again, one of the other things that was kind of interesting for us to learn was that there are really no disposables over there. There's no dietary department or cafeteria. Nurses sterilize and package all the sterile equipment that's used in the OR and then also on the units. They prepare and serve oatmeal for breakfast and maybe even do some of the other meals for patients. They bring their own meals with them because they don't have the opportunity to run to the cafeteria or call out and have something delivered or run across the street to fast food. In addition to working in this HIV clinic and the small hospital there in town, we also had an opportunity to visit 2 nursing programs and learn about nursing education. So we went into Johannesburg for that and Port Elizabeth. So students really walked away from this experience with a very new perspective of nursing practice and medical care, which they would not have had if they had not had this opportunity in South Africa. It's very difficult to replace the learning that occurs in a clinical setting or a study abroad program. Now, moving on to your discussion question, it's a little different this week. There's a statement from your book that you'll be asked to discuss and support your opinions or beliefs with peer-reviewed articles. And then there's the assignment. So you have assignment 1, and your readings and discussion posts that we've had up to date really should help you with this assignment. It's a 4 to 5 page APA formatted paper. You need to write your philosophy and vision of teaching and learning in no more than 1 page. So keep your philosophy to 1 page only. Then you want to select a curricular issue of significance within your employment setting. And your employment setting may be a college, university, school of nursing, could be a medical facility, maybe you're working in staff development department. So just identify a curricular issue that you're having within that area. Then design your active learning activity for a traditional face-to-face group of learners that addresses your issue. And align your active learning activity with an active learning theory. And if you remember, we did discuss those in week 1. So a couple important things is to remember that you'll have to write your learning outcomes for whatever the activity is that you're developing, in addition to a method of learning assessment or an evaluation that's supported by current evidence-based practice. So examples of some of the activities and theories are provided in the assessment or in the assignment link. And I just want to mention that that is not an exhaustive list. So, you're free to use other ideas if you have them, as long as they meet the requirements of this assignment. And then review and follow the rubric for this assignment, which is also right there in the link, and that'll help you to identify what you can and can't do for this particular assignment. So this is our plan for week 3. You can tell it's a very full plan. Let me know if you do have any questions, and I look forward to reading your discussion post and your paper this week. Have a great week, everyone.